Thanks to our changing lifestyles, least exposure to early morning sunshine, and almost no physical activity and food choices that don't exactly add the right kind of nutrition, vitamin D deficiency has become quite prevalent, especially amongst women, and most often it's their post-pregnancy phase. So to discuss the symptoms and cures for vitamin D deficiency, I spoke to Dr. Abdul Fazil from Aster Clinic and Hospitals. Well, we're discussing a very important topic today that most people are going through, especially in this country, is vitamin D deficiency. Yeah. What is vitamin D?
Vitamin D is a special vitamin. The importance of vitamin D was not known till recent years, and it's a very important vitamin because it's one vitamin which is not present in any of the sources of what we eat. So we have to depend on more of a natural source of vitamin to have that normal requirements in the body. Of course, now the more research have shown that vitamin D is associated with a lot of diseases. One of them is something linked to cancer, linked to depression, linked to some other chronic diseases like kidney diseases. So the importance as we go and as we learn new things about vitamin D, I'm sure vitamin D plays a very important role in our life.
What is the function of vitamin D?
Yeah, bones maximum contains calcium. So for the proper functioning of the bone, we require calcium absorption. And without vitamin D, this calcium is not absorbed in the body. So vitamin D deficiency finally lands up in demineralization and softening of the bone. Okay. It is particularly important in infants and in elderly because that is the time when for a baby, in fact, to be honest with you, these are the time when the bone starts growing, and if you don't have enough vitamin D, they get deformed bones. It's called as rickets in children, and in adults it's called osteomalacia, where there is softening of the bone and they result in easy fracture. So other important functions of vitamin D is it has a role in maintaining a homeostasis. Every cells in the body right now require vitamin D for its proper functioning. It is something like a thyroid hormone where for energy, we require thyroid hormones. It's similarly, vitamin D also requires for the proper energy.
What are the symptoms of vitamin D deficiency?
They come with a very vague symptoms like easy fatigability, depression. They feel as if they are not interested in doing their work. They feel as if they don't have enough energy in them. So the basic complaint is easy fatigability and muscle weakness. They have tender spots like pain all over their body. So these are the common symptoms. A clinician should suspect whenever the patients come with these type of symptoms to check for vitamin D. So basically, if you look into the bottom line, the vitamin D deficiency presents with weakness and muscle pains.
Okay. Who is more prone to this?
Vitamin D requirement is maximum in an infant as well as in an elderly. Infants, because we don't take them out in the sun, and that is the main source of vitamin D for human beings. And elderly, of course, even they are more of a bedridden and they don't get enough sunlight. So those are the population which are more prone for vitamin D deficiency. Normally, we don't have any food source which are rich in vitamin D. Basically, we have something like some oily fishes, sardines or salmon fishes. Other than that, eggs, meats, and that to the percentage is hardly 10 to 20%. So the rest of the 80% has to be through sunlight, or it has to be supplemented with medications.
So how do we manage this deficiency?
Yeah, as I told you, since we have 80% of vitamin D synthesized from the sunlight, so we had to go out in the sun for at least a minimum of 30 minutes, either morning sunlight or evening sunlight.
Okay.
In Dubai, it's difficult to get time. I know people are very busy, so 95% of the populations are deficient in vitamin D. Unfortunately, what happens is I've seen so many patients who come with vitamin D and I give them oral medications. They come back after 3 months and they say the level is, when you check the level, it is either low or it's remained the same. So they ask me what happens. I have taken so much of vitamin D, where does it go? The answer to this question is actually what happens is whatever vitamin D we eat, only hardly 5 to 10% is absorbed from the body. Okay. The rest of the thing is just goes out of the system. So unfortunately, we have to supplement it with medication, with tablets as well as injections sometimes.
I completely endorse that because a few months back I was diagnosed with vitamin D deficiency, and I was fatigued and was easily getting tired by doing things which usually I'm not, and when I got it checked, it was I was deficient, and I started taking the tablets, and I see tremendous changes after 3 months. But it does take 3 to 4 months.
Yeah, it does take 3 to 4 months. So you should educate the patient and tell them that the duration of therapy is more important here, rather than taking 2 weeks and then stopping the medications. You don't get any benefit.
As you said, so many people going through it.
Yes.
It's time for us to take it seriously.
Take it seriously, absolutely.
That's why you are on the show, to spread awareness, and thank you so much.
Yeah, thank you so much for calling me.